If your goal is to get this flawless glass skin look that is trending in Korea, here are the ways to achieve it. Hi, I'm Dr. Peter Chng.
I'm Dr. Lu.
I'm Dr. Chai.
So today we are going to talk about this glass skin look, What is actually a glass skin look?
So a glass skin is a Korean trend in which the skin is exceptionally smooth, clear, porous, luminous, looking like a polished sheet of glass which can reflect light beautifully. And it's about overall skin health and also radiance, not just about makeup, and focus on a smooth texture and also deep moisture.
So less wrinkles, less pigment, shiny, I think, like a glass. Right? So what are the methods that can be done to achieve this glass skin look?
Yeah, I think the first step is always start at home. Good hydration skincare is very important. We can use a product that contain hyaluronic acid and also antioxidant, glycerin, ceramide, some of the product that contain tranexamic acid as well. It can help to brighten up the skin as well.
Sunscreen is also very important, right? Because we know UV causes aging skin, causes pigmentation, causes denature of the collagen on our skin, denaturization of the elastin on our skin. So that's why we always advocate patients to prevent from getting UV exposures by all the shields and everything, and besides that also putting on sunscreen.
So always wear a sunscreen with broad spectrum protections like SPF 30 or above, and even if you are indoors. And also reapply if you are out for the extended hours.
So what are the in-clinic methods?
One of the popular in-clinic treatment that patient likes to do in clinic is SilkPeel. SilkPeel is actually a modified microdermabrasion without any downtime. We use the machine to actually exfoliate, remove the dead skin, and then extract all the dead skin and also infuse the solution that we want. There are a few solutions that we can use in this SilkPeel treatment. We have hyaluronic acid that we can hydrate the face. We have salicylic acid that we can remove the oiliness of the skin. And also we have vitamins to brighten up the skin as well. So the treatment is very gentle, usually take about 15 to 20 minutes. And then patient don't feel any pain at all.
So we can target according to patient's needs, right? So some patients have very oily skin, so we can use the salicylic acid. Some patients very dry skin, we can use the hyaluronic acid. Whereas somebody who has very darker pigments, tone issue, we can use the vitamin C to infuse inside.
So another options for glass skin is carbon peel. It helps to deep cleansing the pores, reduce oil productions, reduce acne, shrink the pores, and brighten the skin. And also, it helps to stimulate collagen production for more radiant look without downtime. So this process involves applying a liquid carbon onto the skin, which will absorb the impurities. And then the lasers, like anti-yak lasers, is used to vaporize the carbon particles along with the debris. And it will result in an instant look, pores reduction, and also a more radiant complexions. So it's good for those who are seeking for a quick radiance before an event. One session is enough to give you a good results, but 3 to 6 sessions is recommended for a good long-term outcomes.
So normally you advise patient to do it. What is the interval that you advise patient to do it?
Once a month.
Once a month.
Yeah, I think a lot of this procedure that we do, right, it's also recommended to be once a month. Simply because normally our skin will be shed off periodically every 30 days. That's the natural process. But unfortunately, as we age, some areas become 40 days, some areas become 50 days. That's why it's no more smooth. And when the light reflects on your skin, it doesn't reflect directly. So it gets stuck there somehow with those angles. So once you remove the dead skin on top, and that's why you get the glowing skin as well. So a lot of these procedures are to be done monthly. What about lasers? What are the lasers that we can do to achieve that glassy skin?
Another laser that we can do to patient is actually laser genesis. It's a long pulse anti-yak laser which target on the dermis layer. It's also heat up, it's very gentle, you can do it monthly. And then we always call it lunchtime treatment. Patient come in, they finish the treatment within 20-30 minutes, then can go back. That heat that generated during the laser can actually stimulate the collagen and then give you a glowy effect. It's an immediate effect. But however, it doesn't last very, very long. So patient always do it monthly. It's a very gentle treatment.
So what about botulinum toxin or skin boosters? Can they help to achieve that glass skin look?
So I think skin booster is an excellent option to achieve glass skin because it's able to deliver ingredients like HA, polynucleotides, amino acids deep under the skin for a deep moisture. So ingredients like HA actually attracts water and it helps to plump up the skin to create a moisture barrier for long-lasting hydration. Whereas PN, it helps to stimulate the repair of the damaged cells and also improve the healing potentials.
Botox is helpful because it relaxes the muscle, give you less wrinkle, your skin looks very smooth. You do micro Botox, very little tiny Botox at the face, then it gives you a glowy look.
Yeah. So when we do micro Botox, we don't inject into the muscles, right? Because we don't want to weaken the muscles. We just want to create that glassy look only. Because if you inject deep inside to some areas, you can weaken the muscles. Patient may have an asymmetrical smile, a weird smile, or droopy eyes.
And this micro Botox can also be added into the skin booster for pore reductions, control oil, besides minimizing the fine lines like Dr. Lu mentioned.
So you don't have to inject patient twice, right? Just inject once because we mix everything together. Just inject once only.
Yeah. And other ingredients like tranexamic acid for pigmentations can also be added.
Succinic acid also is another one that can help with pigmentation. I know we have said it many times in a lot of our podcasts about lifestyle, but it's still one of the most important things to achieve that glass skin look. What are the lifestyle changes that you advise patients?
Get enough sleep for skin repair.
Eat a balanced diet,
Non-smoking,
no alcohol.
Exercise regularly, manage your stress.
yeah. Psychological stress, from work, from family, or physical stress. Like you mentioned, lack of sleep. Traveling is also very stressful, especially those that change in time zone and everything. All these are considered stress as well. In order to achieve this glass skin look, you need to combine the right products, lifestyle, a good lifestyle, and some in-clinic procedures. If you don't know where to start, talk to your doctor about it.